Well, I think the genomic sequencing is very powerful, not just to look at mutations within the CLL clone, but also to assess for minimal residual disease. And more attention is being paid to minimal residual disease with the advent of more effective therapies. I think we have to put all of this into context because some mutations have been associated with adverse outcomes, but you have to ask what has been the treatment that has resulted in the adverse outcome. And I think we have to understand a genetic risk factor that is a bad prognostic indicator, which means that overall the patients with this genetic marker are going to fare worse than other patients regardless of therapy, versus a genetic risk factor that connotes a poor response to one type of therapy versus the other. I think the future is going to be able to elucidate those factors. I firmly believe that all of these genetic factors are not going to be prognostic factors, but genetic risk factors that may govern our selection of the type of therapy as well as sequencing of therapy or combinations of therapy that we can use in selective patients so that we can mitigate the risk of developing resistance.